Hi, my name is Gloria McGrath, and I focused on heart failure and specifically the Kansas City Cardiomyopathy Questionnaire as a means of promoting self-assessment in patients with heart failure. So the whole idea around this questionnaire is that heart failure patients are taught how to self-assess themselves as a means to adjust their self-care behavior, to lower readmission rates, and to just better manage their symptoms and lower chances of exacerbation. Healthcare professionals can use this with patients on an inpatient or outpatient setting, and then patients are encouraged to use this questionnaire at home as a means to manage their symptoms. So this questionnaire is 15 questions long. The first question targets activities of daily living, so dressing yourself, bathing and showering, walking a block on level ground, doing yard work, housework, or carrying groceries, climbing a flight of stairs without stopping, and then hurrying or jogging. And the patients are given a scale to choose from, ranging from extremely limited to limited for other reasons or did not do the activity. And then number 2 focuses specifically on symptoms of heart failure such as shortness of breath, fatigue, or ankle swelling, and how have these changed over the last 2 weeks. And patients are encouraged to choose on a scale between much worse to I've had no symptoms over the last 2 weeks. Targeting down into these specific items, the first one being swelling, is the next question is, over the past 2 weeks, how many times did you have swelling in your feet, ankles, or legs when you woke up in the morning? Again, the patients have a scale that ranges from every morning to never over the past 2 weeks. Number 4 targets again on swelling, and then it says, over the past 2 weeks, how much has the swelling in your feet, ankles, or legs bothered you? Again, the scale ranges from extremely bothersome to I've had no swelling. Over the past 2 weeks, on average, how many times has fatigue limited your ability to do what you want? So patients are encouraged to say that all of the time fatigue keeps them from doing what they want, all the way up the scale to never over the past 2 weeks have they been bothered by fatigue. Another question focusing on fatigue is, over the past 2 weeks, how much has your fatigue bothered you? So again, it ranges from extremely bothersome to I've had no fatigue on this scale. Number 7 is, over the past 2 weeks, on average, how many times has shortness of breath limited your ability to do what you want? Patients have a scale that starts at all of the time and then goes up to never over the past 2 weeks. Number 8 is, over the past 2 weeks, how much has shortness of breath bothered you? So specifically targeting the respiratory status of the patient, them being aware of it. Scale ranges from extremely bothersome to I've had no shortness of breath, just like we saw with the fatigue question. Number 9 focuses on, over the past 2 weeks, on average, how many times have you been forced to sleep sitting up in a chair or with at least 3 pillows to prop you up because of shortness of breath? So the scale ranges from every night to all the way up to never over the past 2 weeks. Question 10 says, heart failure symptoms can worsen for a number of reasons. How sure are you that you know what to do or whom to call if your heart failure symptoms get worse? So again, this is putting it on the patient to be accountable for their heart failure symptoms and to notify their providers in a timely manner, which is very important in managing exacerbations. So the scale is not at all sure to completely sure. Then 11 is, how well do you understand what things you are able to do to keep your heart failure symptoms from getting worse, like weighing yourself every day, eating a low-salt diet, managing your stress levels. And again, patients have a scale that says, I do not understand this at all, ranging all the way up to I completely understand. Number 12 targets actually psychosocial and psychological items for these patients, which is, over the past 2 weeks, how much has your heart failure limited your enjoyment of life? Again, another scale is given, and then similarly, patients are then asked, if you have to spend the rest of your life with heart failure the way it is right now, how would you feel about this? So again, targeting psychosocial and psychological feelings. Number 14 does the same and says, how often have you felt discouraged or down in the dumps because of your heart failure over the past 2 weeks? And again, patients are asked to rate these items. And then lastly, it targets heart failure affecting the lifestyle and asks specifically about hobbies, working or doing household chores, visiting with family and friends, and then intimate relationships with loved ones, and again gives a scale. So although the scale doesn't have strict scoring measures, it is supposed to be used as a marker for providers to help manage these patients, and then for patients to help manage themselves and their symptoms, and therefore manage exacerbations of heart failure and manage their symptoms by targeting psychosocial, psychological, respiratory, and cardiovascular status throughout this assessment. And this assessment hopefully will help patients stay out of the hospital. Thank you.